So when we're looking at diagnosing ADHD and autism, it's really, really important for a good therapist to do their homework because there's so many overlaps between ADHD and autism that it really does take like a proper amount of diagnostics and testing and assessments and interviews to actually figure out what's going on in a person's brain. I mean, for instance, both of them have genetic traits. Both of them have issues with sensory processing. Both of them have issues with executive function. Both of them have issues with social communication and emotional regulation. When we're looking at sensory issues, both ADHD and autism can get overwhelmed with sensory issues, but they get overwhelmed for different reasons. With autism, it usually tends to be more of a too much noise makes a person shut down, whereas with ADHD, oftentimes it's more of a too much noise makes the person just very distracted, or too many sensory things makes the person very distracted. Too many things to focus on means that brain can't stay on one task, versus too many things to focus on makes brain go bleh. And yes, that is a technical term. Both have issues with executive dysfunction. Planning, organizing, carrying out tasks. Both ADHD and autism have issues with this, but for different reasons. And this usually comes out in the assessment process. And of course, I don't want to get too much into that one because everybody's a little bit different. Everybody functions a little bit different depending on their own experiences in life. Social cues and social interaction can both be very difficult for people with ADHD and autism. With ADHD, there tends to be more of an issue with like sensory processing disorders or auditory processing disorders where we're not actually hearing the person as much. Also, we tend to be very bored in conversation, especially if it's small talk. God, kill me if you do small talk. I would rather, honestly, like anything in my life than small talk. It hurts my soul. And then there's also the issue with social cues. Both ADHD and autism have issues with social cues and maintaining relationships, but for different reasons. With ADHD, it's the whole out of sight, out of mind. There is only now time and no other time than now. There's now and not now. Whereas with autism, it's more of a difficulty maintaining the relationships because the understanding that like the work that has to be put in continuously to maintain a relationship is frustrating and often overwhelming and sometimes not worth the energy. Both ADHD and autism deal with hyperfocus and hyperfixation. With ADHD, there tends to be more time blindness and lack of comprehension of things going on around them, whereas with autism, it tends to be more of a long-term special super duper interest that lasts a long time, known as monotropism. When we're looking at things like rejection sensitivity, both ADHD and autism are both very, very sensitive to the sense of rejection or criticism. Eye contact, not fun. It's just, nope, nobody likes it. If you're neurodivergent, eye contact is stupid and has to be trained in. Sleep disturbances. Both ADHD and autism have issues with sleep disturbances, and oftentimes for the same reasons. And of course, a profound lack of interoception. That is not really understanding or feeling like noticing what's going on in your body, noticing like you're hungry. So cues, like internal cues, hunger, thirst, having to use the bathroom, fatigue, pain, being tired, all those things. We just don't pay attention to it, especially if we are focused on something externally. ADHD, there tends to be more issues with attention, hyperactivity, and impulsivity, whereas with autism, there's more issues with social communication and interaction, as well as like sometimes repetitive behaviors or things like that with special interests. We're engaging repetitively over and over and over again. But ADHD can do that too, and both stim for similar reasons. And yes, it is not uncommon for someone to have both. There's anywhere between, depending on like what reviews and studies read, anywhere from a 50 to 70% rate that if you have one, you have both, but not everybody does, and some people do. Also, there is not an uncommon I forgot the word, an uncommon pattern of individuals with ADHD and autism also having other learning disorders. There's also a higher chance of other comorbidities like bipolar, OCD, borderline personality, and things like that to accompany these neurotypes. So yeah, there you go. Something that you know. Maybe you already knew this, maybe you didn't, but now you do. Hooray!